Hi guys, in this class we'll learn about the clinical symptoms. Okay, in mild cases of diabetes mellitus, no symptoms may be seen. The diagnosis could be incidental during blood or urine investigations. As it says, in mild cases or it's the starting of diabetes mellitus, there will be no symptoms. Okay, but mostly we will discover it either by blood investigation or routine urine or blood investigations. We will discover that we may have diabetes, or we have pre-diabetic conditions, or we have the diabetes itself. Okay, some other clinical symptoms that mainly shown in diabetes mellitus patients are, see, first one is polyuria, means excessive urination. Okay, especially at night, frequent or we can say frequent urination, especially at night. Polydipsia, as I said, polyuria, frequent urination, that results in this frequent urination result in excessive loss of water, so resulting in a polydipsia, that is excessive thirst due to loss of water from the body. Polyphagia means increased appetite or to increase or to urge for sweet items of food due to a heavy loss of urine in sugar. Mainly what we observe in urine test means we have ketone bodies or ketone bodies plus, which is a metabolite of sugar. Okay, in diabetes patients, excessive ketone body shows that excessive or heavy loss of sugar from the body. Next, loss of weight. Okay, loss of in spite of having eating more, there will be loss of weight, because as I said, the carbohydrate. See here, that's what I'm saying. This is most important. Carbohydrate here, carbohydrate, that is sugar, is carbohydrate which is energy giving to us. Okay, and what proteins and fats do? Protein helps in bodybuilding and fats result in fatty tissues where it should be, or it helps in putting weight. Okay, here that's what happened with heavy loss of sugar, means sugar is removed through urine or it will be stayed in the blood. Okay, what will happen? Cells require energy. As a compensation, it as a compensation, proteins and fats get metabolized. They enter into metabolite process and results in giving in energy, which is generally abnormal, because in general what will happen, the blood the sugar or carbohydrate in the blood generally is taken by cells, and the proteins and fats gives body weight and the bodybuilding access bodybuilding materials. But here what happens, as I told, diabetes is a metabolic disorder. Here what happens means the protein and fat gets metabolized instead of carbohydrates, which have to be metabolized. Okay, this what this result in decreased weight. Okay, because absence of carbohydrates or something, it happens, what will happen, the fat will be utilized. So since there is no fat or protein for bodybuilding, generally loss of weight is seen. See, lassitude means lassitude and lack of energy. Untreated diabetes can cause easy tiredness, drowsiness, because lack of energy, and even coma later stage. Piritis valve. Irritation in the genitalia caused by local deposition of sugar from urine. It also causes disturbed sleep. What I said, deposition of urine, because the blood has sugar which is filtered by the kidneys and removed by the kidneys through urine. What will happen, sometimes it will be irritated to genitalia because they localize deposition of sugar from urine there, result irritation. Paresthesia, a tingling sensation felt in hands and feet. Blurred vision, excessive deposits result in eye lenses causing refractions, result in blurring of vision. We will learn about diabetic retinopathy and everything here. Delay in wound and minor infection. Lack of nutrients to the wound delays wound healing. Minor recurrent infections such as boils, skin and urinary infections. If major infection, consult the doctor. Okay, mainly we see are polyuria, polydipsia, polyphagia, loss of weight, paresthesia are the earliest symptoms. Polyuria is due to osmotic diuretic effect of glucose in kidney tubules. In return, polydipsia due to dehydration resulting from polyuria, as I explained earlier. The failure of glucose and protein utilization by body causes the loss of weight and tendency towards the polyphagia, as I told. Paresthesia apparently caused by loss of body protein. Okay, diabetes should take special precautions to prevent infections of the foot and urinary tract. Generally, patients with diabetes, as you guys know, tendency of diabetes generally increased in India. So people tend to take it light, or they neglect the diabetes because they don't know what and how much damage it causes to them over period of time. It doesn't causes fastly or frequently or initially or acutely, but long term it definitely shows some compromising conditions.